Good day, everyone. You are welcome to the System Podcast. Today, we are continuing on our 1G revision series, and today we'll be talking about episiotomy. Now, episiotomy is a surgical incision of the perineum performed during the second stage of labor to enlarge the vulvar outlet and assist vaginal birth. So, you would see it's one of the most common thing which is done in the labor ward. In fact, the midwives can even do it. So it's something very common that you can come across. So the surgical technique. Now, episiotomy is performed in the second stage, usually when the perineum is being stretched and it is deemed necessary. The incision can be midline or at an angle from the posterior end of the vulva, which is called a mediolateral episiotomy. At a 60-degree angle to the midline is usually recommended. Now, a midline episiotomy is an incision in a comparatively avascular area and result in less bleeding, quicker healing, and less pain. So as you can see from the screen, you can see the mediolateral incision, which is at 60 degrees angle. Now, however, there is an increased risk of extension to involve the anal sphincter. That's one of the problem of the midline incision, but it's the best because it's a relatively vascular area. So you have to take note, a mediolateral episiotomy should start at the posterior part of the fourchette. So that the fourchette is just a fancy name of saying a fork-like or fork-shaped structure, specifically the fold of skin where the labia minora meet above the perineum. So that's the fourchette in relation to the perineum that we are talking about. Now, then you move backwards and then turn medially well before the border of the anal sphincter. So this is simply the procedure which the steps like how the episiotomy is basically being done. But you need to know that before doing all this, as it's just this is a revision series, so we are not going in depth, but you are expected to say some of these things before doing all this. Definitely you have to have take permission, like a consent from the patient. So, but in that stage, the patient is in serious pain. The patient will not really rationally give you a consent. So they will definitely say, do anything for me. So it's good to take the consent before even going into delivery, like telling her that if so happen, like would have to do an incision for you to help you deliver successfully. So it's very important. And then you don't just do the incision just like that. You have to give a local anesthesia. In AKTH here, they use lidocaine, or just inject it to the area and they do it. So that's something you have to take note of. So the complications, now there's short-term and long-term complications of episiotomy. Now, the short-term complications, perineal trauma or episiotomy, include pain, infection, and hemorrhage. When you open, you make a tear. Definitely, we are expecting that it's an open area. An infection can easily set in there. So you have to take note of that. It's very important. And pain, if the anesthesia is not adequate, the person can feel pain. If you cut in the wrong way, you can make a lot of bleeding. Now, long-term effects include dyspareunia, that's pain during sexual intercourse, incontinence, that's um, involuntary loss of either urine or feces, uh, and incontinence on flatus. So another form of incontinence too. So thank you all for listening to this short one on episiotomy. I hope you have achieved a lot from this. I also like you to comment, to also read more on it. So thank you very much. Like, subscribe, and share to your friends. See you guys in the next one.